Hello everyone, my name is Dr. Sujeeth Kumar Sinha. I am working as an associate professor at the All India Institute of Speech and Hearing in the Department of Audiology. This is the month of September, and third week of September is celebrated as Balance Awareness Week. Basically, Balance Awareness Week is celebrated to create awareness about the vestibular disorder or the balance disorder among the general populations. Now, today I'm going to highlight about one of the most common occurring vestibular disorders or the balance disorder. This balance disorder or the vestibular disorder is known as vestibular migraine. Typically, when the patient they come to my clinic with a report of vertigo and the history of vestibular migraine, typically their history goes like this. They say that, doctor, I have a spinning sensation. I do not know what is happening to me. Some days are good, some days are bad. Some days when I get up in the morning, I feel that whole world is just spinning around me. I hate this feeling. My family needs me, but because of this problem, I cannot do anything at home. These are the words of some of my patients who consult me for their vertigo issues. And most of these patients are basically females. And these patients are either homemakers or working at the office and managing the household work also. The typical routine of this patient is like this. They get up early morning 5 to 5:30, wake up the kids, prepare breakfast and lunch for them, send them to school, pack lunch for their husband, pack lunch for them, and take bath, then puja in few cultures, have their breakfast between 9 to 10 a.m. In case they are going to office, work the entire day at office, come back home in the evening, prepare dinner for everyone in the family, look after the homework of kids, etc. Basically, they are completely occupied with different work from morning to evening. Once they have developed the episodes of vertigo, it becomes challenging for them to cope up with all the pressure at work and the vertigo. This patient suffer from a condition which is known as vestibular migraine. Vestibular migraine is the most common condition that leads to a spontaneous episodic vertigo in approximately 10% of the patient with complaints of vertigo. In the last decade, vestibular migraine has emerged as one of the significant cause of vertigo. The main body of evidence for vestibular migraine is provided by the epidemiological data demonstrating a strong association between migraine and the vestibular symptoms. That is, all the patients with vestibular migraine have a past or a present history of migraine. Although vestibular migraine can occur at any age, it rarely occurs after the sixth decade of life. Around 30 to 50% of the children and adolescents with vestibular symptoms report episode of headaches associated with their vertigo. In most of the patients, the migraine with or without visual aura starts earlier than the vestibular migraine, and typically females are more affected than the males. Familial occurrence also has been reported in some patients. The most common complaints of patients with vestibular migraine is the spontaneous episodic vertigo. The duration of the vertigo can last between minutes to several days. Vertigo gets aggravated during the periods of stress. Vertigo also worsens in females during the menstruation cycles. Since patients have presence or history of migraine, vertigo can occur along with the episodes of headache. Sometimes vertigo also occurs independent of headache. Many patients also experience positional vertigo lasting for several hours to days. They also report imbalance and nausea, which is aggravated or provoked by the head movements. Patients do not get proper sleep. The total sleep duration is reduced, or the patients do not get good sound sleep. They also have a complaints of visual disturbances while scrolling the images on their mobile phones or scrolling pages on the computer. These patients typically avoid watching anything on their mobile while they are traveling. Other dominant symptoms are intolerance to the sound, intolerance to the light during an episode of headaches or vertigo. Patients will prefer switching off the light and sleeping, and will also have a fear or dislike or aversion to a smell or odors. The diagnosis of vestibular migraine is typically made by taking a detailed case history. Apart from the case history, the Bharani Society and the International Headache Society have given diagnostic criteria for vestibular migraine. To understand the damage to the vestibular system, vestibular evaluation using tests like vestibular myogenic potentials, video head impulse test, video nystagmography, posturography, etc. are required. Now, coming to the treatment part of the vestibular migraine. Now, the treatment of the vestibular migraine are twofold. First is the medical treatment and second is the lifestyle modification. The treatment for vestibular migraine should start with effective counseling. The clinician should counsel the patient regarding the migrainous origin of the vertigo. This will relieve the stress and the tension of the patient that they do not have any other severe kind of problem that is causing vertigo in them. Also, the patient should be counseled to identify the triggers that is causing the vertigo. So the patient should make a list and should maintain a diary for 15 or 20 days to see that what and all are the factors that is causing the vertigo in them. Such as, for example, at some point of the time they are stressed and that stress has caused the vertigo, or if they did not have a good sleep in the previous night, that has caused the vertigo, or certain smells such as in the puja room, most of the time agarbattis are a common osmophobic agent that causes vertigo in these vestibular migraine patients. So the patient should make a list or maintain a diary wherein they write about the triggers that is causing the vertigo, and the patient have to learn to avoid this trigger to avoid the vertigo. Also, certain food habits need to be changed, such as patients should avoid caffeine, that is coffee, tea, or any caffeinated soda, marinated food, soya sauce, any food that contains monosodium glutamate, etc., to avoid the vertigo occurring in them. Also, they should get a proper sleep. That is, the patient have to identify a particular pattern of sleep. So that means to say that they have to follow a particular pattern of sleep every day. Also, the sleep should be a sound sleep and minimum 6 hours of sleep patient should have. Also, the patient have to, the gap between the sleep time and the mobile screen time should be at least 2 hours to avoid any kind of a stress that happens because of the screen. And also at the last, the patient should seek the help of medical professional for the treatment of their migraine. Thank you one and all.